opinion oriented, not vague, and we should be responsible. We should feel responsible while doing it. Emasculation, the first clause, taking away the masculine power. Taking away the masculine power of a male. By that can be applied to cutting of the penis, cutting of the gonads, cutting of the gonads, deprivation trauma to lumbar region, and can even emasculation can happen due to application of some drugs. It means there is a impotency. Impotency supervenes, and due to that certain drugs can cause, certain nerve injuries can cause cutting of the penis can cause, even hormonal disturbance can cause. So we should be aware that which thing has happened and which injury has led to which one, and which is the end result, and we should be able to interpret that. There is a difference between emasculation and castration. Emasculation is cutting away the penis, both penis or testes, one penis or one testis. Then again we'll be doing that. Castration is cutting away only gonads of the lung, only gonads means only testes. May be destroyed by their function by chemicals. Sometimes chemical castration is happening nowadays. These testes are being destroyed by chemicals, so decrease the hormone and decrease the libido. So in some countries they are doing it. In case of rape accused or certain serial offenders of sexual assault, they are using it to chemically castrate them. But if we are doing, if the law is doing, law people who are enforcing the law, they are doing it, then they get it justifiable. Then if we are doing it with intention is to make somebody important, then we will be held responsible for that. That will come under grievous clause. Circumcision, forced vasectomy during emergency, clidectomy isn't correct. Castration, because forced vasectomy during emergency was a state phenomena. If it is a state phenomena, then the states take the responsibility of their act and they justify it by some means. We don't go into that. We are only concerned with what is being practiced and what is being prescribed by the government. Cutting of artificially constructed restored penis, if somebody is gone into sex change or artificially constructed penis is there and somebody has destroyed it, then it also goes into grievous hurt. Female castration can happen, but it is not. It doesn't come under this law of emasculation. It goes in under law, that under clauses of that are clause 4 and 8. It can be considered as a member of the body. Female castrations are happening in some areas, not in India especially in areas of Egypt and all, where the female castration happens, and they try to cut clitoris and some parts so that there is a decreased libido for female, and that is in India. If it is happening, it comes under the clause 4 and 8, and that is also grievous hurt, and that will cover under that. If the injury is sometime in the spinal or the nerve injury, that is also covered in some fracture around that, or some other injuries, that also decreases the libido of the female. So emasculation is mainly deals with the male, and other female injuries which can lead to decreased libido and all that can be covered in other clauses also. Sight, which we have already discussed, the second clause, we can here write its second clause of grievous hurt. Permanent privation of sight of either eye privation means loss. It includes even partial loss of sight, that is permanent. Operative interference is not taken into be considered if somebody is having cataract by trauma and that cataract is being removed nowadays by surgery. That is still is includes the that is still includes the trauma, and that is still includes the uh, that is still includes the grievous hurts. So we can say that if an injury is happening, it has happened, and nowadays we have come up with better skills to reconstruct it, but that doesn't serve the purpose. We, if the injury has happened, the past complete loss has happened, then it is happened. No matter what surgery is going to take, surgery itself is a, if it is not done with consent, it is itself is an injury which is being done. If somebody is just operating somebody without consent, it comes already comes under to grievous hurt. So if somebody has done trauma to somebody, caused lens to go opaque or cataract, and forcefully goes for trauma for operation again, then it has committed double crime, double time grievous hurt. So we should be we should be aware that of that. Sticking needle inside eye, putting corrosive material in the eye, it can lead to erosion of the conjunctiva and the cornea. Gouging of the out eye, complete gouging of the complete taking of the eye, retinal detachment due to some blunt force, and there is a increased blood clot into around the eye. These all can leads to decrease percentage of loss of vision, which is permanent, and this all comes under the grievous hurt. This is the injury to the lens which has gone, and this is the trauma penetrating eye injury. The complete nail is there inside the eye. So these all are grievous hurt, and though the surgeries can correct some vision, but they all comes under grievous hurt. The site, it is operative interference. Again, this is the site that comes under second clause. Operative interferences was taken into account. Same injury would be classified as a hereditary grievous hurt that I have already discussed, depending on whether cornea was available or not, or whether cornea transplantation or surgeon was available or not that. Because these IPCs mostly know, some people know that these were designed in 1860. In 1860, mostly the operative procedure which we are having nowadays mostly not available at that time. So once the injury was done, it is done, and we should the account of operation and operative procedures were not taken into consideration and still not taken into consideration, because that is the remedy, not the recorrection. It is the remedy that, and sometimes we cannot recourse or reconcile, and that it is the judgment of the court also. We should stick to the what the IPCs and the other laws says. Reduction of vision in some injuries, injury causing reduction vision of from 6/6 to 6/9. It has reduced. Color vision effect, color vision has been lost, cones of the eyes has been lost, rods are there only of the retina. In the intraocular lenses, now which are being placed inside the lens, inside the eyes after the operation, somebody displaces intraocular lenses of the person, then that person has That person has caused grievous hurt because is replacement of that grievous that injury, a replacement of that lens, replacing that lens is will require surgery. Surgery of the eye itself is a grievous injury. So if you are forcing someone by your act to a surgery, then you are causing grievous hurt in that process only. So we should refrain from that any injury which has come to such an extent that requires surgery or percentage of loss comes under these clauses should be refrained. Many forms of trauma to the eye, example conjunctival hemorrhage, lenses dislocation, subhyaloid dislocation, subhyaloid hemorrhages, retroverbal hemorrhages, and retinal hemorrhages may all lead to permanent privation of sight. So we should retinal hemorrhages, bulbar hemorrhages, lens dislocation, conjunctival hemorrhages, subhyaloid hemorrhages. These all cause uh, vision disturbances, and so these vision disturbances can lead to permanent loss of the vision. What is not permanent privation of sight of either is throwing chili, sometimes some irritating substances thrown in the eye, and we are unable to see for some time. But after some time, when the inflammation or infection subsides, then we are perfectly fine to see that. Then it is a simple hurt, not grievous hurt. That a chili powder in the eye gets severely inflamed, inducing blepharospasm. Means we just constrict our eyes. Person cannot see. After a week's inflammation disappears, person can now see clearly. This is the hurt under section 319 IPC, not 320 IPC. Hearing problems, then again the privation hurts. Here stands for clause third is here. Grievous hurt stands for privation, stands for permanent percentage of loss of the hearing in either ear can result from various causes which each of may constitute the grievous hurt. Tympanic membrane rupture. For example, if a teacher slaps a student, resulting in the rupture of the tympanic membrane, causing him to lose hearing. Sometimes people say that tympanic membrane ruptures. There is a complete loss is there. It heals also, but the grievous hurt has happened. So we don't consider the healing process of the tympanic membrane. So we as when it will come to us as a opinion for that, then healing process will not be considered in that, and we should stick to that. Tympanic membrane rupture itself is a grievous hurt. Operative interferences, even if the tympanic membrane is reconstructed through surgery, the injury is still considered grievous. If we go for the tympanic membrane repair, tympanic membrane repair, then it is also considered to be a grievous hurt. So, any reconstructive surgery generally do not compensate for the grievous hurt, or it may sometimes even cause grievous hurt again. Hearing exposure to the hot liquid, sometimes hot liquid is poured in the ear, pouring of hot liquid into ears, damaging the structure of the ear, impairing hearing, causes grievous hurt. Quack treatment, seek treatment. Sometimes people seek quack treatment, those who are roaming about in the society without qualification and all that. They are some, in our terms called as quack. People seeking treatment from there, and from quack cleaning the ears, quite insert a stick into the ear and puncturing the tympanic membrane that can cause grievous hurt. Well, very simple. Sometimes stepidotomy complication means stapedius is being replaced by slapping, which has undergone stepidotomy, causing displacement of the stapes foot place, causes grievous as Stapes is like that. It is a bone which is like that. This is a foot plate. If it is placed here, it placed there. Now all the functions are going normal. But somebody slaps and this foot plate is placed somewhere else, moved somewhere else. It is a grievous or hurt because we have to correct that. If we correct that, we have to go to the surgery. So it requires surgery which can cause grievous hurt. Psychogenic deafness. If a victim suffers hearing loss due to psychogenic factors such as exposure to explosion leading to no physical rupture of the panic membrane, but psychiatric opinion attributes to the loss of hearing to the psychogenic causes, it still falls under grievous hurt. So, if there is explosion or something like that, person is psychologically disturbed to hear and hearing is impaired, then it is comes under the grievous clause. Membrane or joint. Membrane, member or joint. We should remember that member is mainly we consider the organs of the body like liver, like spleen, like kidneys, like the heart, lungs. These are supposed to be the member of the joint. Member or joint. So even limbs can be considered member, or limbs can have joints also. So any distinct part of the body which has its own function is considered to be a member. Privation of any member or joint refers to loss or permanent impairment of any part of body capable of performing a distinct function and unable to regenerate. This is the very important point. It is not able to regenerate itself. Liver regenerates sometimes, but most of the organs don't regenerate. So if we are doing something to them, we cause them permanent damage, and that permanent damage is causing grievous hurt. Member means any organ or limb or subject responsible for performance of distinct function. Like it includes eyes, ears, nostrils, mouth, hands or feet. So we were not given the clause of mouth earlier. Nostrils are not there. Eyes and ears are having separate clauses. Hands and feet are sometimes having fractures. So nostrils and mouth are now also being considered as a member because they perform distinct features. Joint may be the both small or big joints. Loss of hair, nail would not come under this clause. Hair and nails are keep on growing. If somebody cuts somebody's nail, if it is able to regrow, then the grievous hurt has not happened. Somebody has forcefully shaved somebody's hair, then it can regrow. Then it doesn't come under grievous hurt. Member or joint, fingers, cutting of fingers, hands, feet, etc. all constitute examples of grievous hurt. Female genitals, mutilations, all types of female genital mutilation are considered grievous hurt. Female breasts are considered members. In India, cutting of women's breast often as a form of punishment for resisting forced prostitution and constitutes grievous hurt. We have said that in not first clause that was emasculation, but the females clause are considered here in member or joint category. Clause 4 that female genital mutilation, all types of female genital mutilation are considered grievous hurt. Female breast mutilation considered as a grievous hurt. It is covered under clause 4. Clause 4. If somebody asks you or us about this, we should remember that if an organ or member is there, then it is dealt separately, and if it is dealt separately or it has a distinct function, then we can say that it is a grievous hurt. Impairing. Impairing destruction of a permanent impairment of power of any member of joint. Here the power function. Power means function. If a joint is not working, not able to open it or not extend it or flex it, then or not able to stand and walk, then it is the impairment of function and it is a grievous hurt. Sometimes contractures develop, it is a grievous hurt that they are not allowing us to expand our limbs or expand our other body parts. They can cause impairment and they can cause grievous hurt. The clause is attracted for privation not caused by member or joint is not amputated, that is not amputated, but has been destroyed or permanently impaired. If not amputated but has been destroyed, like pulping, sometimes pulping happens, the whole hand is crushed, that is called pulping. Sometimes whole heavy vehicle moves or rolls on our body or in machinery is there, whole hand is not amputated but pulp means bones are formed, reduced to very brittle structures, small structures, all the body structures are not able to be found and not being repaired, able to be repaired, then it comes under the grievous clause. Striking hammer or somebody's finger so that its fingers is reduced to pulp. Finger is being struck by a strong hammer and this habit is reduced to pulp and none of the features of the bone and all that can be identified. So means that this fracture has already occurred and then again it is being reduced to pulp and not able to perform function. The grievous hurt is already happened. Someone is a factory worker, his hand is caught in a defective machine for none of his own fault. The hand is not severed from the body or amputated but is reduced to pulp. Again, hand is just reduced to small fragments and all that and which is not able to function properly. Then it is a grievous hurt. Brick is thrown. Somebody has thrown a brick on somebody's back and the spinal cord is damaged, paraplegia has happened, then there is a impairing of the functions of the lower that legs are not working, and other parts are not working. If somebody is stuck here at the neck at the back, then the hands are also not working. Then these conditions can lead to impairment of the functions and that falls under the grievous hurt. So generally injury to the spine we take very lightly, but injury to the spine if it happens by prick or by bullet or by spear or pointed objects, that can lead to paraplegia, hemiplegia or the paraparesis, and these all can lead to impairment of the function of the person and further it can obviously can lead to grievous hurt. We should be very much now here comes the especially the spinal injuries patient. We should be very much careful in evaluating the history, whether the person has fallen himself or somebody has pushed him. This is this is a phenomena. Whether something has fallen on his back or somebody has thrown something on his back. These are the various very same phenomena but the different intention. Same phenomena but different intention. If somebody is working on the top and something has fallen from his hand, brick and all that without intention and that has landed to somebody standing below, causing the paraparesis and all that, then there is also a grievous hurt, but the intention is then not there. So court will decide on that, but the grievous hurt has happened. So our part is that we should know that a grievous hurt has happened or not, and if it has happened, we should mention it, and the police should be informed. We should inform about the direction of the force. We should inform about the possible causes about which may have caused or which may possible causes have not caused this, so that we can help the investigating agencies in that, and we can be very helpful, because as a medical doctor we are very much aware that sometimes we are very evident in pointing out the direction of force being applied to the body, and that even that can be helpful, that can be very much helpful to the investigating agencies about the if they get the direction, they can point about the sometime point out to the distance, they can point out to the person standing there. So when simple direction or simple another clue if we are providing with the with our injury reports which we be preparing or which we prepare daily, then that can solve the case, and that can also reduce the burden on the judiciary system, and not which is our judicial system is being burdened by a number of cases. So that as a good citizen, we can help them to reduce the number of cases by just preparing good reports, evident reports, and clear reports, so that we will be helpful to that. Disfiguration. This is another part of the part that we generally consider, that what is disfiguration of the face and what is not the disfiguration of the face, and who are subjected to the disfiguration of face, who may not who has got disfiguration but may not be considered. So we generally form our own opinion based on the morality and the society and their behavior, caste, creed, and the color. But everybody is beautiful and everybody is complete. So we will be considering that in mind. For example, the abrasion and laceration of face are simple. Abrasion is the simple one and heals without scarring, whereas laceration of the face causes grievous hurt because it forms a scar and disfigures the face. Branding of forehead or cheek. This is one of the phenomena which was going on in the older days. That's branding of the forehead and cheek. They just to give their stamp. Hot stamp is being put on the mainly on the slave people, or so that they can be recognized from far places. In 1995 in Punjab, the cases came to light that where some female pickpocketers were branded Jeb Khatri. Female pickpocketers were branded Jeb Khatri over their forehead by Punjab police. This practice, although done for the apparently good cause, warning public easy identification, but it is illegal and amounting to grievous hurt. If you are branding some people thief or branding some people mentally disabled, then if branding is that, then we can say that we are doing for the greater good of the person, but it is we are generally committing a grievous hurt. So it is the state has to prioritize that, and individual right can come up as against the state act, and various articles 21 or an article 14 and various right to life and various dignity can come up. So we have to be very much cautious in doing that. Careless suturing of the facial wound, leaving a scar mark on face. This is again leaving a scar mark on the face. It can come in our part, that if we do not do our work properly, then it can happen. It can happen, and cutting of nose and ears, usually punishment for adultery in India. This is again the grievous hurt. Nose and ears, sometimes adultery is it is a not a moral crime, not a legal crime. So, but still the people brand some people, boycott some people, then there are various practices going on. We are not going into that, but if with that on ground of that there is a cutting of nose or the ear or anything, then we should be refraining from that. Injury causing deviated nasal septum is a grievous hurt caused by disfigurement of face. Piercing of nose and ears for ornament without consent is also disfigurement. Scars on the face of a young unmarried girl, an actress, an old woman, all these are the grievous hurt that I was telling in the earlier slide. There's unmarried girl, an actress which is sometimes considered very beautiful, and the old woman which is considered to be an old and having various skin looseness. So all these are considered beautiful and they should not be, their face could not be disfigured. Tattooing of the face without consent, vitriolage, now very heinous crime in our society. Throwing of acid or alkali on face of females with intent to cause disfiguration. Generally, this crime comes due to hate and jealous people who generally throw acids on the females or the young girls to disfigure the face and try to damage the face and try to damage the life of the person. And it is a very heinous crime, and it is has been dealt separately in IPC 226A and B, and it is a punishable offence up to 20 years, 10 years or 20 years. So vitriolage, we should be having cases of acid or alkali burn, we should get it confirmed whether it is acid and alkali burn, and if we are able to confirm it, we document it and possibly take the photograph and attach to the file so that we in future it can be proved that it was due to acid or alkali, because after this scar is healed, sometimes people after 10 years can say that it is due to the simple burn. So the case can be converted into a vitriolage case, from vitriolage case to grievous hurt, for which the punishment is low. So we should, as a doctors or the medical legal expert, we should emphasize on this, that for vitriolage cases we should be at least having photographs disfiguring an already disfigured face. It is not a defense to, if a face is already disfigured, then it is not a defense to cause that, say that we can disfigure it again and it is a grievous hurt. Pulling of ear and ear ring or nose ring or ringed ears through ear lobes or ala of the nose all cause grievous hurt. So these things can be there. So we should be aware of that this can happen at any time, anywhere, and we cannot say that somebody's face is already disfigured and we can further disfigure it, or vitriolage, which is very prevalent in our society, and we should be aware of that. And pulling off the many ornament from the face, it should also be discouraged, and we should be able to understand that what is happening there, and we should be able to document these injuries. Fracture and dislocation of the various parts of the body. Fracture or dislocation of a bone or tooth is a fracture is legally defined as a breach of continuity of the surface of any bone. Many authorities wrongly suggest that the order to legally in order to legally qualify as a fracture, the discontinuity in the bone should be up to the level of medulla, but this can be anything. For example, hairline fractures can be considered as a fracture, cut on the bone in the fracture and thus grievous hurt. So any kind of fracture can lead to grievous hurt. So we should not be abstaining from that it is not a grievous hurt or it is a grievous hurt, and we should be sometimes we can be over-interpreting it. So we should also refrain from that. Shotgun plate lodged in bone, it means it has already caused the fracture there, and thus the grievous hurt. Sometimes multiple plates are there in the muscle or the subcutaneous tissue, but that has not entered into the bone, so it will not amount to the grievous hurt. Partially united fracture, but it has already partially united or not, but somebody has already caused a fracture again, then it will be considered as a grievous hurt. Green stick fracture, especially in children, which is not a complete fracture, but it is also considered to be a grievous hurt. So we cannot say that if it is a fracture in adult or the fracture in the children, green stick fracture, that it is not fracture, and we are supposed to write it as a fracture, and that is also considered to be a grievous hurt. Fracture dislocation, sometimes sigmoid bone such as patella is a grievous fracture. Fracture of sigmoid bone, fracture of hyoid can occur by manual strangulation, that is also a grievous hurt. If the victim does not die, accused can be sued under causing grievous hurt. Fracture only of outer table of the skull, such as a gutter fracture, the gutter fracture. Sometimes the bone, if bone is there, and the bullet is coming here and fracturing here only and leaves there. So bullet has gone something like this from coming here and gone like this, then it has already caused the fracture of the outer table, then it is considered to be a grievous hurt. Dislocation of shoulder, grievous hurt, because the dislocation of the bone occurs. It is also a rare example of grievous hurt, which can be corrected within a minutes. Fracture dislocation, again dislocation of artificial joint, it is a grievous hurt because relocation can need surgery. Cartilage fracture is not grievous, as the word recommended in the law is the bone, not cartilage. Ossified cartilage is not bone. So we have to understand that if the cartilage is there, then it is not grievous hurt. So cartilage fracture is not grievous hurt. Bone fracture is grievous hurt. Cartilage fracture can be considered in another term and in another clause, but not in this clause. Miscellaneous hurts, we have come to the sometime it is in the last clause, that is the 8th class, which is endangers life, which causes sufferer to be having 20 days of hospitalization or bodily pain and unable to follow the pursuit. So pursuit, an ordinary pursuit, that I have already told that the clothing and the eating, going to the washrooms and all that, so that we can say that it is a grievous hurt. Any hurt which endangers life, it means which has 50% chance of ending in the life. Especially dangerous in the injury is the injury report. We should enter it. Endangerment can be very short duration only, but it can be a grievous hurt. We can come to the example. For example, all head injuries, compound fracture of the skulls, burns involving greater than 1/3, hemorrhage greater than 1 liter, injuries to the large blood vessel, injuries to the abdomen, that can cause grievous hurt. Again, single bruise is not, but multiple bruise can lead to a hemorrhage up to 1 liter, that is a grievous hurt. and various laws are there. Even sometimes a nose bleeding by a person can cause a grievous hurt or even a death also, but the intention may not be there. So we should be aware of that, what is going on in this clause. Any hurt which can cause sufferer during the space of 20 days to severe bodily pain. Bodily pain is a subject. Again, this is a subjective matter. Now it will come back to us whether it is clear or not, and we have to just specify on that. 20 days we should we should justify the hospitalization, and ordinary pursuit we have to also justify on that. In case of doubt, opinion of the doctor is necessary. 20 days phenomena, it can be divided into two groups and with breaks that can also be considered. Ordinary pursuit, that is I have already explained it. Comma for 20 days, not going to the job, a person is confined to bed for 18 days, and person also not able to use bed pans and all that can cause grievous hurt. As a duty of a doctor, we should be able to do all the and refrain from over interpreting, do all description, guide the police. Reverse doctor interpretation, court can reverse it. Doctor must not contradict it. Its own opinion. Doctor must refrain from giving opinion regarding the nature of injury caused by or finding of the other doctors. Medical importance is aggravated penetrating sexual assault that can be dealt in separate lectures where we commit suicide and we commit a crime in further. As per the POXO Act, we will be dealing in separately. Thank you very much for this lecture and being with me. In next lecture, we will be telling you how to prepare the injury report. So, thank you very much.